Hey guys, Dr. Luke Stringer at Advanced Health Chiropractic, and we're back talking about neck pain. And a really common, frequently asked question we get in the office is, when I get out of pain, why does my pain keep coming back? And it's a great question. And essentially it's because of a consequence of our environment, right? The environment that broke you down, unfortunately, more often than not, does not change. So if the environment that broke us down doesn't change and we don't modify our habits within the environment, then we're obviously going to continue to essentially see this resurfacing of neck pain. So neck pain can be caused several ways, right? Biggest two ways are trauma, so a car accident, significant slip and fall, a contact injury, and that can obviously create damage within the spine, the soft tissue, the joint or the disc, which may not be reversible, maybe irreversible. Now we're talking about more management of the pain. However, the majority of the patients we see in the office, essentially what we call our corporate athletes, right? People who go to work hard for a living, work 40, 50 hours a week, and they spend the majority of their time sitting. We are built to move, both on a biomechanical and a physiological level. So when we're sitting for a living, over time it breaks the body down. So let's quickly go over exactly what we expect to see within the spine, and then we'll go over how that environment breaks us down, and if we don't address essentially the root cause of the issue, your problem's just going to keep resurfacing. So when you evaluate the spine from the side, your cervical curve, your neck curve, you should be able to see your ear on top of your shoulder, top bone meets the bottom bone, you should be able to see a nice 42-degree curve. It's important to have this curve because it does a couple of things. But the biggest thing it does is carries the weight of our head evenly on the back of our spine. Our head can weigh anywhere from 12 to 15 pounds. And when we have good weight distribution and balanced strength within the tissue, it allows for pain-free function. However, when we sit 40, 50 hours a week, everything's in front of us, right? So what happens to the spine? It shifts forwards. And what happens is our spine shifts out of alignment. So as we discussed on previous videos, what happens is the soft tissue becomes lengthened, and when it's in a consistently lengthened state, that stress and tension breaks it down. It becomes full of adhesion. It's kind of like scar, or it is scar tissue. Imagine chewing gum in a muscle. And the second thing that happens is the weight of your head shifts forward, and you start loading the front of the spine, and the weight isn't supposed to be carried in the front, so that's when we start seeing degenerative changes within the disc. So if we take medication to mask the problem, we do lots of stretching and stabilizing to essentially get out of pain and stabilize the joint, you're going to get some relief, right? Obviously the medication is just going to mask the problem, you're not really addressing it, you're kind of hiding it. And then if you stretch and stabilize, and that's great, but the two things that we need to do. First thing we have to do is address the damage in the soft tissue. So let's go over that for a moment. So imagine when your cervical spine, or you're in good posture, your neck's in good curve, that tissue locks and functions with a little bit of resting length on it. However, when we're sitting at our desk for a living and we start to do this, the tissue lengthens. And over time, that lengthening breaks it down, becomes weak and flexible, and it actually gets formed within a tissue of substance full of collagen, essentially adhesion forms. That tissue is weak, it's inflexible, it limits our range of motion, and by limiting our range of motion, it can actually break down further. So if we don't specifically break down that adhesion in the tissue via specific treatment methods, then that adhesion is going to continue to sit there. Well, research clearly states that that tissue breaks down quicker than healthy tissue. So if you're not addressing the adhesion in the tissue, but you're out of pain, then obviously that problem is going to keep coming back because it's still weak and inflexible. So essentially, we function with this curve that's gone straight, and as we've discussed, the weight of your head shifts to the front and continues to load these discs. That increases the intervertebral disc pressure. Those discs are going to continue to bulge and hit those nerves. So again, if we're not addressing the curve within your spine, then you never actually get into the root cause of the problem. And that's what we do really well at Advanced Health Chiropractic. We can objectively diagnose the issue within the spine. Is it structural or functional? We can then, through specific treatment, address poor joint function, poor tissue health, and poor posture. And when you combine those three things together, not only can you get out of pain quickly, but it's also a long-term correction. And obviously we educate you on essentially creating good habits at work. Are you standing as well as sitting? Are you taking postural breaks? Are you doing your rehab, pre-post exercise? And that's something we pride ourselves on at Advanced Health Chiropractic. So if you've had neck pain, the neck pain keeps coming back, I encourage you to click the button at the bottom of the video, fill out the contact form, take care of the $39 special. One of our team will be in contact, and we look forward to seeing you in the office so we can get this corrected long term.